You are here for the first time, we applaud you and we commend you for taking time out of your busy schedule to come to an event like this. So someone who invited you here must have really cared a lot about you. And for you to listen to the invitation, accept the invitation, it must mean that you felt that there was something of value that you might be able to derive from a meeting like this. So again, we would do our best to try to make it well worth your while. We have a lot to share with you, a lot of information that I believe to be extremely valuable. But the most important thing is we have Professor Prasad with us today, and he's going to be able to give us yet some more enlightenment and help us to appreciate how it is that you and I, average people, can take charge of our health, what we can do to be in control of what happens to us. Because to be quite frank with you right now, and I think you all know this too, we don't have a whole lot of say as to what happens to us. Right now, it really does seem like, depending on how you roll the dice, that's what happens. You know, my mother-in-law, she's 94 almost, and her oldest son, 74, just died yesterday. So the family is dealing with that right now. So how does this happen? Her youngest son, at age 50, he died 10, 12 years ago. How does this happen? How is it that some live longer, and how is it that some have shorter lives? Is it just chance? Is it just because of where you happen to be? Some feel that way. Some feel that it just, when your time is up, they say, your time is up. But Dr. Prasad has done some research that I think will help us to potentially change the outcome. You know how if when you're driving a car, they have proven the number of deaths are reduced when you wear a seatbelt? There's now evidence that you can take an action step and change the quality of your life and the outcome and longevity of life based on specific actions that you take. And it's all linked to some of the information that Dr. Prasad is going to be sharing with us today. So if there's someone that you care about, it's not too late. Call them, pick up the phone, give them a call, send them a text message. I think they can even join by YouTube. In fact, if you are listening on YouTube right now, thank you very much for joining us. Please like, subscribe, and share. It helps the YouTube algorithms see that there's some value in discussions like this, and there are people who value this type of information. So please help us out with that. We appreciate your joining us to that end. So my name is Jonathan Jones. It's my pleasure, my privilege to be your host and moderator for the afternoon. And again, thank you for joining us. Today is Sunday, and it's September the 29th, 2024. Our discussion today is going to center around, it's actually the part 4, the last part of 4 parts discussion that we've been having since it was deemed National Blood Cancer Awareness Month. We focused on blood cancer and put forth an effort to try to make people more aware of blood cancer, its ravages, and action steps, again, that a person can take to feel better and potentially alter the outcome of their situation. So that's what we're talking about today. Now, just a little bit of a housekeeping. You can see our screen just kind of gives you the information there. So, National Blood Cancer Awareness Month. So it looks like I'm looking at a different screen here. By the way, last week I don't know what was going on, but last week I had a horrible problem with being able to see my screen and see what you were looking at the exact same time. So it appears as though that corrected itself. Several updates kicked in, updates from Windows and updates from Zoom, because apparently there was something there that they were conflicting with each other that finally got reconciled. So for housekeeping purposes and to keep us legal, we have to inform you that the FDA has not evaluated these statements. Testimonials that you're going to hear are purely anecdotal. Results are atypical. What happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any of the authorized representatives are making claims that any supplements recommended will treat or cure any disease state. See, only the government can declare a natural substance to be a treatment or cure for disease. This presentation is for information and educational purposes only. It's not intended to be a substitute for visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. However, when you're hearing information, instruction from a gentleman who was the professor at the University of Colorado School of Medicine for some 30 years, you're listening to a professor reveal scientific fact. And a lot of the initial statistics and data that we're sharing with you is just easily researchable. You can find it yourself. I'm the research director for the Healthcare Support Association of America. So I spend a lot of time doing research, reading things just because I want to know. I want to know, and I don't believe it should be in the dark. And I still will never forget the day that the intensive care nurse said to me that she was praying for my mother's immune system to kick in. My mother was intubated and dying. And I thought that they were actually doing something. Okay, intubation means that they were extending her life. But that woman said to me, we're praying for her immune system to kick in. And my whole world fell apart. I couldn't believe those words because I really did believe that that was possible for the intensive care at a hospital to be doing something more than just praying for her immune system to kick in. I had the prayer part covered. I'm a firm believer in the power of prayer. We had that covered. But since then, I did a complete career change. I went from computer electronics and engineering into the healthcare arena because I believe that the human body is just like a big computer, and if there's something wrong with it, it can be reconciled. I firmly believe that. In fact, I'm going to show you a couple of examples we talked about over the past couple of years. If you're the kind of person that don't want to see an open wound, just cover your face right now because the next two slides are going to have some open wounds to it. So consider yourself warned if that's a problem for you. So just put your hand over your screen, and we'll let you know when those images are passed. But here's something that, to me, highly illustrates that something that's broke can be unbroke, just like a computer. So this gentleman here, his name was Rick. This is back in August of 2023, so barely a year ago. He had this huge hole in his face. Basal cell carcinoma was the official diagnosis, but he ran into, no pun intended, a health advocate who cared about him and gave him a recommendation that pointed him toward something Dr. Prasad had formulated. And look at the pictures on the right. November 2023. This is not Photoshop. This is not AI generated. These are real photographs. That man no longer has a hole in the side of his face there. And he had taken, I think, 30-some rounds of radiation. It was gone. So in my day, when I was much younger, in my 20s, I repaired a lot of computers. I engineered boards, drew circuits that resolved issues. If something was wrong, we created a solution or found the solution. That's what, in my mind, I'm looking at. I believe that could happen to the human body. I believe it can happen to anybody under the right circumstances. This next picture is the same thing. This is a different kind of cancer. This is melanoma. Now, Dr. Prasad, you're looking at the picture on the left, April 18, 2024. So this is not long ago, only about 6 months or so ago. Dr. Prasad said melanoma is one of the most deadliest forms of cancer. And that woman was about to lose her foot. Her doctor was recommending amputation because it was getting worse. They didn't want it to spread into her lymphatic system and potentially kill her. That's why they were recommending take it off. This woman ran into another health advocate who recommended that she take a look at something Dr. Prasad had formulated. It wasn't a cure, had nothing to do with curing her body, but it had everything to do with empowering her body to do what it's already capable of doing. And look at the date. That's less than a month later. It's only about 15 days later. That hole in her foot had closed up. All the pain was gone. She's going up and down stairs like she had before. She's walking up and down mountains. This is in Ecuador, like she did before. She did a lot of volunteer work. She got her life back, and she was able to resume her volunteer activity. Less than a little over 2 weeks later, that transition took place. Again, I believe that the human body, much like a computer, something's wrong with it. You can do something to reconcile it and make it work the way it was engineered to work. And that was proof of that. So those are just a couple of examples of certain kinds of cancer. But see, we're not talking about those types of cancers this month, because there's one thing to say, okay, here's a mass, here's a tumor, here's a wound, here's an open sore that's caused by cancer. What about when it happens to the blood? And that's what we're looking at this month, because this month is National Blood Cancer Awareness Month. And quite frankly, I don't think I would have ever focused on blood cancer had it not been Blood Cancer Awareness Month. And just sort of been following that over the past year or so, because it helps us now to delve into a lot of things that's on the mind of people. That's kind of why we're doing that. It's on the mind of people. Some people are curious about it, and they're now being given an opportunity to hear what can make a difference by the Professor Prasad himself. So what's blood cancer? Very simple. Malignancies that affect the blood, bone marrow, or lymphatic system. That's what blood cancer is. Leukemia, lymphoma, or myeloma. Those are the main types of, the three main types of blood cancer. The blood is important for transporting nutrients and facilitating immune response. Blood is life. You have to have it, and it needs to work properly. It can be cancerous. And this illustration, I think it's AI generated, but it's showing those white blood cells. And the role that they play is they eat something that's not supposed to be there. That's what they do. That's what white blood cells do. So leukemia affects white blood cells. Lymphoma impacts the lymphatic system. Myeloma targets plasma cells. So those are the three different ways, three different types of blood cancer and the parts of the circulatory system that they affect. The latest statistics, 184,720 people in the United States were diagnosed with some form of blood cancer, leukemia, lymphoma, or myeloma back in 2023. That's almost 10% of all new cancer cases is a type of blood cancer. In 2023, 1.63 million people were living with or in remission from some kind of blood cancer. And again, these are statistics that you can easily look up. The references are right there, or they can be provided. I guess you can't see the hyperlink behind those links there. Survival rates is indicated here, but the deaths, as you see from that second bullet point, blood cancers were expected to cause around 57,380 deaths in the United States in 2023. And with more than half of them, or roughly half of them, being leukemia alone. Now, there was a time, I have to just kind of throw this in there, when leukemia used to be the #1 form of death for children. It used to be leukemia. And I dug this statistic up someplace, and I really shouldn't tell you this unless I can actually show you the facts, but it just came to mind when we're looking at leukemia. It was about 5 or so years ago that the #1 type of cancer in children switched from leukemia to glioblastoma, or some form of brain cancer. That was according to the World Health Organization. And isn't it interesting that nowadays children know more about tablets and electronic devices than many adults do? They're experts at it. It's become a babysitter. So ask yourself the question there: does radiation play a role in this situation, in this discussion? Well, maybe Dr. Prasad will tell us a little bit about that once he goes on to tell us a little bit about the treatments, a little bit about what his recommendations are, and some of the formulas that he's put together and the research that he's done over the years. So let me introduce to our discussion now Dr. Kedar Prasad. Dr. Prasad is the world's first radiation biology PhD. That was back in 1963, the world's first. So he shortened up an 8-year course and just knocked it out of the way there. And let me just become the first one and graduated early with it. His formulas on micronutrients have been awarded 10 U.S. patents. I believe it's up to 11 now, and there's a couple more patents pending. He was awarded $12.5 million by the U.S. Congress to do research, and he formulated the product called military micronutrient formula. Dr. Prasad is the gentleman who discovered that the anti-cancer potency of vitamin E succinate. He also discovered that butyric acid is an anti-cancer agent. Now, if you're wondering what butyric acid is, that's specifically something that comes from good bacteria doing its job in the gut. So you're talking about someone who not only has expertise with micronutrients, not only someone who has expertise with cancer, someone who has expertise with the gut and the microbiome. We need to listen to what this man has to say. And we're going to be talking about the microbiome in coming months. In fact, we're going to spend some time on that in coming months, because turns out, did you know that every disease has a microbiome signature, like a fingerprint? Every disease has a specific microbiome signature. So you improve your microbiome, you literally can improve your entire life. But we'll let Dr. Prasad give us some education on that down the road. He was a professor at the University of Colorado School of Medicine for more than 30 years, former president of the International Society of Cancer and Nutrition, invited to be a member of the Royal Society of Medicine in London. He was also invited to be a member of the Nobel Peace Prize nominating committee for candidates in the category of medicine. Among his many works, he authored 33 books. I think that's like 35 right now. He's been published more than 250 times in peer-reviewed publications. I think it's closer to 300 times, 300 articles now. But there's more than 450 references to Dr. Prasad's works in PubMed. So scientists, brilliant men, stand on his shoulder when it comes to their research and finding things that they need to find. So I'd like to welcome to our discussion Dr. Prasad, and to say thank you again, Dr. Prasad, for you being willing to take time out of your busy schedule, time away from family, to join us in discussions like this. Thank you very much, sir.
I always enjoy with you, Jonathan, and engaged family, and whatever I can contribute, I will be happy always to do so.
Well, we appreciate that that disposition that you have. I think everybody's laughing right now, saying whatever you can contribute. There's not enough hours in the day for us to sit down and listen to what you could contribute to the discussion, and somehow or another we have to contain it into this little 1-hour segment that we have aside for days like this.
Here is you discussed the blood cancer.
Yes.
And you gave a very nice presentation of a statistic and so on. And commonly treatment for blood cancer at this time is radiation, chemotherapy and radiation, and combination, both. And especially, and this is interesting, the chemotherapy kills rapidly dividing cell. You know why? Because it generates, most important action is it generates a lot of free radicals.
Okay.
So free radicals is one of the major causes of death of the cancer cell following chemotherapy.
So cause cancer cells to divide, is that what this is talking about?
Yeah, block it. Yeah. Block it and it kills it. Not only kills it, completely eliminate it, but also it blocks it. So they cannot divide. And so this is all due to excess, because they produce different types of free radicals. And radiation therapy, same thing. They also damage or inhibit the growth of the cancer cell, primarily by generating excessive amount of free radicals.
Okay, you got all this bad stuff.
Yeah,
trying to do something good.
And again, immunotherapy is right now in an experimental stage. And it shows that some like check cell point inhibitor. There are some other immunotherapy, but really they're not as effective as the chemotherapy and radiation therapy.
I see.
Yeah, here is the T cell. The monoclonal antibodies lab produce protein that bind to cancer cell. But see, if you produce antibody, you have to produce antibody against one protein, then suppose. But cancer cell has many, many different mutations. You can't take care of all those damaged protein. So it is not very effective. Plus, this drug is very, very side effects. Checkpoint, I was mentioning inhibitors, help your immune system recognize cancer cell, but again, it is not sufficient to kill, have significantly improvement in cancer therapy. So immunotherapy used after chemotherapy, radiation therapy and chemotherapy have failed to do anything. Then they go to chemotherapy, and also they go to gene therapy.
That's interesting that you say that, Dr. Prasad, because it sounds like to me, because I've heard people kick back and brag about the advances that are taking place in cancer, but you're saying that there's limitations there. So that's something
exactly.
I'll take note of.
Yeah, no, nobody has ever used just immunotherapy. You know, only time immunotherapy, that one case that I know, a friend of mine, has worked is that he has a melanoma tumor. And so the doctor, at that time, immunotherapy was not well developed. So they grind up their own tissue, melanoma tissue, remove surgically, grind up, and produce antibody.
Okay.
And then they injected antibody, and tumor cell got killed. But today's immunotherapy is not that. You use a selective target for killing these cells. But there are many mutations. There are many different types of gene defect there. So you cannot take care of that. And so, again, they have tried, in gene therapy has been tried. Because one of the major problems with gene therapy is delivery. How you deliver suppose the gene is missing or has been defective. First, how do you eliminate defective gene? It is going to be there. So what they try to do is that they try to the copy of the normal gene, they put in a virus, and then they deliver it. Then virus, they get picked up by normal cell too. And that is a toxic. Virus can cause cancer in normal cell too. So there is a lot of limitation of gene therapy. And again, gene therapy, trying to modify it, but never used by itself. They use always in combination with radiation or chemotherapy when they are not working. You see what I mean?
I see.
Yeah. So still, for blood cancer, radiation therapy and chemotherapy remains the major method of treatment and have been very successful in children, 89%. Or more than that, but acute, as you know, this is acute fatigue, nausea, hair loss, infections, emotionally anxiety, depression, and stress. And so the question is how you do it, how you take care of this now.
But that's interesting, Dr. Prasad, that you said that these things have had some success, but the cost is still going to be the side effects. You're still going to have to pay for it.
Because these are the major concern of oncology, how to reduce them. They don't know how to reduce them. Not only this is acute side effects, but also don't forget that many survivors of blood leukemia, for example, they later on develop new cancer, which has been induced by cancer, or reoccurrence of the old tumor, and also non-cancerous damage, like the wound of a non-dividing tissue like brain tissue necrosis, and they cannot be healed. So there are also non-neoplastic diseases, fibrosis of the lung, for example. And so these are, they don't know how to take care of that.
I see.
And that's why our proposal comes into picture.
Right.
Here is the survivalship and quality of life. Long-term effect, as you mentioned, secondary cancer, secondary tumor, but also reoccurrence of the primary tumor, the initial tumor. That is also a risk. And a new cancer, secondary cancer is a new cancer, cognitive changes in brain, heart, could be also lung fibrosis if the lung is involved during treatment. And quality of life is very poor during that time. And so the question is how you take care of that. And right now, they don't have any way how to take care of that.
Very interesting. Very interesting. Well,
They
folks
don't.
need to know that that your background, besides the things that I mentioned, is quite extensive. And I just did a quick count of how many publications you've written on the subject of cancer. And on the left side of the screen, I found, let's see here, I think one. Oh, what happened? Go back.
Okay.
I found 1, 2, 3, 4 books on the left side of the screen that was on cancer. Then on the right side, I found 1, 2, 3, then 4 more, 7, and then an 8th one. So somewhere around 12 different books that you've written on the subject of cancer. So folks need to know that this has been a very serious endeavor for you. But so you've come up with some new research, though.
Yeah, exactly. That's what I want to emphasize. So the proposal that I'm going to show you about how to not only improve the survival rate, 5-year survival rate, improve further more than what they are doing right now. And the second is how to also reduce the acute effect as well as late effects of radiation. And and you can see that what we show that first, that high dose antioxidant, you have to remember, not low dose, like preventive dose that we have in the micronutrient, for example, EMF. We call it a preventive dose because this is low dose of the radiation. That is good enough to prevent many health issues or reduce the risk at least of many health. But high dose antioxidant, for example, I would define vitamin C, for example, 10,000 gram would be considered high dose. Mm-hmm. Vitamin E, again, normally is about 400 international unit. I think it could be 600 international unit of vitamin E succinate. And in our formulation, for example, so we have separate formulation for this thing. But what high dose antioxidant differ from low dose antioxidant, and that's why oncologists did not believe in the beginning and that the antioxidant will interfere with the effectiveness of chemotherapy and radiation because antioxidant will scavenge or destroy free radicals. And this is true. Some people who have tried preventive doses of antioxidant during treatment, sure enough, it protected normal tissue, but it also protected cancer tissue. So that's not good against radiation or chemotherapy. So that was not good. And so for a long time, it was not possible to distinguish why it is happening. It was bothering me because we were the first one, actually Linus Pauling, but who was a 2 Nobel laureate. For the first time, he suggested high-dose antioxidant is anti-cancer agents. And I confirmed his work and further extended, not only it kills cancer cell, but and not normal cell, but also enhance the effect of radiation and chemotherapy, and we published it in a proceeding National Academy of Sciences paper. So there was, and then we discovered the same thing happened with vitamin E succinate. Then I said multiple antioxidant is better than that. So this has been a long time. In 1979, this was major discovery was made, but nobody paid any attention to because they could not distinguish between the action of high dose and low dose. Finally, during last 2 years or so, or 2 years maybe, I found out that cancer cell, no matter what kind of cancer cell you have, whether you have blood cancer or melanoma or any kind of basal cell carcinoma, any kind of cancer, or whether cancer has become resistant to all therapy, it doesn't make difference. As long as you are a cancer cell, you will require 2 nutrients for your survival. Cancer survival will be required. One is glucose, another is glutamine. So I said, it occurred to me one time, I said, let us see. Again, I was thinking, see how I explain it. It was bothering me for a long time. Then one day it occurred to me, that let us see if cancer cells require any specific nutrient for survival. Sure enough, we found that the glucose and glutamine, they require it. And they did experimentally in a cell culture system that when they deprive glucose, cell will die. When they deprive glutamine, cell will die. A normal cell would not die. So that I said, then occurred to me, this is a natural thinking when you are thinking about it, how to explain high-dose antioxidant. I said, maybe high-dose antioxidant also preventing the uptake and metabolism of glucose and glutamine.
Wow.
So how do I prove it? So again, I look for the literature. And literature, sure enough, high dose of antioxidant, resveratrol, curcumin, vitamin E, and so on, they inhibit the glucose metabolism and kill cancer cell. It was well established. Many papers. Then I said, maybe high dose antioxidant is working there. And now I have proof that individually they work it, and multiple antioxidants then figure out they will be more effective for various reasons. So now, the tumor cell, again, whether you have blood cancer, any kind of tumor cell, if you deprive them with glutamine and glucose, they will die. And so, and you can see that they do work by, the radiation therapy and chemotherapy work by free radicals mechanism. And they work by preventing, high-dose antioxidant works with preventing the uptake and metabolism of glucose and glutamine. So those by different mechanisms, totally different. And so I think, many cases like you saw, one case is melanoma that this morning. By the way, can you send me those two pictures with me because I'm preparing.
Before this day is over with, I'll make sure I send them to you.
Yeah, and also, the other case, the leg case was a melanoma, wasn't it?
Yes.
Yeah. So I mean, and so it was interesting to see that so quickly in 2-3 weeks. I mean, it is a miracle. But I mean, somebody would have said theoretically without picture. I said he's lying.
I know, but we can call it a miracle or whatever. But what we're seeing here and what we're hearing is hard science.
Yeah.
And I hope that everybody was paying attention to what you just said, sir, because this kind of summarizes it. But that's the way it's. Listen, folks, what you just heard is the way a scientist thinks. A scientist says, there's a problem. I wonder if someone has already done the research on this. He didn't have to look under the microscope. He found out that, yes, it's been proven that glucose and glutamine are necessary. And if they're deprived, the cancer cell will die.
Yeah.
He went and he found out. But then he took it a whole step further now and figured out that multiple antioxidants would have an even greater impact on it. So this is taking it to a whole nother level for us. This is the conclusion right here that everybody needs to pay attention to, what you see on the screen right now, folks.
And so I think it is very interesting that really, if it turned out to be, I'm having a little bit difficulty in getting people's attention, because when they say the word antioxidant, they don't want to deal with anything because they don't have a time, oncologists, to think deeply,
Right.
And so I think, I don't know, but I'm going to India and I will present this thing among oncologists. By the way, I'm leaving for India on October 2nd and coming back on a November 16th.
Fantastic. Safe travels.
And so I will be presenting some of these works in Indian oncologist group. They have agreed to. And see if they can observe it, just like observational data that you are talking about it. The problem is that those people of oncologists, if they are willing to, and I have told you that even since you are the intermediate man, if they can obtain the oncology consent, that here is the thing, give me how you treated them, what is the disease, and here are the results, and they were exactly what the patient was taking. I can publish that in one case report. I mean, in a week I will get invitation 2-3 that please submit a case report They think that I'm an oncologist, but I don't have any data. I mean, I hear it, but detail. And so if you can convince to the oncologist, either of those two pictures that you say, show, then I can write and that will excite people. That will really excite people. Right now, only few of us know about it, right?
Mm-hmm.
But when he published it, the oncologist said, wow, let us do it some more,
Well, it's time for us to get the word out.
And it is so cheap. It will be so cheap.
Well, that's the scary part, and that's the reason why there's often so much opposition, is because people don't want to see a cheap solution, Dr. Prasad. They want to see something complicated.
Yeah. And so I'm not concerned about it. But anyway, so that's one method of doing it. But you also have to worry about what other things is there in the body that aggravate cancer progression. That's very important to know.
Yes.
Or interfere with the therapy of radiation and chemotherapy. Is there any other defect in our body who can do it? And turn out literature shows, and I have published a paper too, that intestinal dysbiosis, change in the intestinal gut, we call it, in favor of a harmful bacteria, we call intestinal dysbiosis. And they have been shown that it participate in the initiation and progression of cancer without any treatment. It participate, not the only agent, but it participate. Because of the intestinal dysbiosis, tumor may appear much sooner than otherwise it would have appeared. So that's why it participates in the initiation and progression of all kind of cancer. And in my publication, I've given at least 10 different types of cancer where it plays an important role in the progression of cancer.
Wow.
That's an important thing to remember, is that when you get radiation and chemotherapy, and most of the people, if you're older, older means 40, 50 years, and not 90 years like me, but then you have intestinal dysbiosis.
Right.
And intestinal dysbiosis, then if you have a cancer and you get a radiation or chemotherapy, that will further aggravate the number of harmful bacteria much more. They will increase because there are many harmful bacteria. Not all are activated by the same time and same mechanism. And so they get further aggravated. And therefore, what it does, intestinal dysbiosis interfere with the effectiveness of radiation therapy and chemotherapy. Not only that, intestinal dysbiosis increases the short-term toxicity of the fatigue and vomiting and nausea and this kind of things. The severity will increase in the presence of intestinal dysbiosis. So it becomes a very central issue, whether you are giving a high-dose antioxidant alone or in combination with radiation therapy, or you are getting radiation therapy, chemotherapy alone. You must reverse intestinal dysbiosis. And one and only way you can reverse it, take probiotics with prebiotics.
Wow. Pay attention, folks. That's a powerful lesson that we've just been shared with right there. That really just highlights the importance of, sometimes you'll hear one of our health advocates recommending that you take Dr. Prasad's probiotics, and some people will say, well, I'm already taking a probiotic, but you have no idea that that we're talking about something on a whole different level. So this is the performance of the Dr. Prasad.
Yeah, probiotic. And the reason this probiotics is more important than say many that you see in the marketplaces, because generally, if you take orally this bifido and lactobacillus bacteria, they are very beneficial bacteria, different strain. But when you take orally, 60 to 70% are destroyed in acid pH.
Wow.
When you go to the intestine, there is a bile acid. They further destroy. So there are very few who reaches lower colon, which is their house, where they divide and form colony. And so in order to protect that, we added 2 probiotics that are not normally present in the gut, but they have been tested in human, and one of them is approved by the FDA, is the Bacillus coagulans, which is derived from the soil. And also another is Saccharomyces boulardii, which is from the east. And they have been tested in humans, is non-toxic, and they don't stay in the gut more than few days. So that's why you have to take every day. And that protects, while you are in acid environment, the acid has to work in all bacteria. But while you are working, you have resistant bacteria, so the beneficial bacteria, at least some of them, will be protected. And so when they go to their home, there will be more beneficial bacteria because we protected them in acid environment to some extent.
Wow.
And so that's why it is unique. And prebiotic is a must, because prebiotics is a food of bacteria. This is the one what they fermented. And when they ferment it, they produce a lot of beneficial substance.
Like butyric acid.
Including short-chain fatty acids, which are also like butyric acid, which is anti-cancer agent.
Well, see. All right, so listen carefully, folks. Got a major lesson there from the professor. But we want to illustrate just how effective and how powerful and how accurate Dr. Prasad's science is. We saw the two cases at the very beginning, but we have another case that we want to share, especially for those who are here for the first time. We know there's a lot of people that have never heard these programs before, nor have heard Dr. Prasad speak. But we want to share a story with you that Jeff Ashby shared with us. It was his own personal story with his father. So I've got the recording right here, so I'm going to try to get us up to that point. And then Jeff can fill in the blanks for us with anything that he would like to add to the story. So hang on just 1 second here. Let me see if I can get us to that point.
9 capsules 3 times a day. So what I'm going to do, though, is because people say, well, it's easy for you to come up with that story. You made a statement about that news that nobody wants to hear, nobody's family wants to hear, because along with that is all the fear, the anxiety. And you talked about the support group that really exists behind those that are going through these procedures. And it hit me right in the heart, because this situation that I'm going to share with everybody here today is that close to home. I mean, we've been working with Dr. Prasad, the micronutrients, the significance of these products, now going on 10 years. This is our 10th year, Dr. Prasad. Can you believe it?
Yeah, I know.
And when something like this happens, I mean, it's easier to go out there and help everybody else, but when it's your dad, when it's that close to home, it takes on a different tone. And so
that's the one you don't want to lose.
I know, and I'm going to have to go back several years. This is over 3 years ago. This was about that time that Dr. Prasad was suggesting these high dose of micronutrient antioxidants, and the formulation had been created. The microdaily EMF had been created, and it was just a natural evolution, a sequence of, let's take this, our very best foundational formula, and triple the dose. Not just go from twice a day to 3 times a day, but to, in Dad's situation, you suggested, Dr. Prasad, that instead of doing 3 capsules in the morning and 3 capsules in the evening, or on the side of the bottle it says take 3 capsules 2 to 3 times per day, you suggested that in a 24-hour period, he could take as many as 27 capsules versus just that original 6 or 9.
So 9 capsules 3 times a day.
9 capsules 3 times a day. So what I'm going to do, though, is because people say, well, it's easy for you to come up with that story, but let me share the whole family. So Dad's support network was in place, because that very call that you talked about happened as my brother and my father were headed home from the doctor's office. And they called me and said, Jeff, what can we do? Do you think Dr. Prasad has an answer? And so let me go back to the text message so that I'm actually showing it. And Dr. Prasad, I'll just pull you off of the spotlight so that it's a little larger for everybody. But this is what we faced, and you'll see the text message right here from my brother, the one who is like responsible for the family trust. And so here it is, May 13th. This is 3 years ago. So looking at this, you can see it right there on your screen. It says, and this goes out to all of my siblings. I'm the oldest of 7. Says, sorry for the delay in getting this out to everyone. Dad had an appointment with the doctor on Wednesday. This was originally going to be the first of 3 IVs of gamma globulin, GammaGuard. However, Medicare insurance denied treatment. So we are meeting with the doctor to find out what is next. Quick side note, Dad is coming off the prednisone, down to 1 pill this week and then off. So we met with the doctor, and he didn't have any good news. He has stopped trying to find out why Dad's bone marrow, and I'll advance it here, is not producing what it should. The doctor's suggestion is to have Dad get a shot in his leg every week for who knows. The shot is Nplate. It's supposed to boost his platelet. That's all I know about the shot. After that news, he talked to Dad about how he feels Dad's maker is calling him home, and has talked to us about hospice. Dad does not want to get the shot, and I've asked Jeff to put together a Zoom meeting Friday night, 8:30ish. Dad is going to be on the call. Dad is also trying MMF, original protocol recommended by Dr. Prasad. I'm not sure about the spelling. My feeling is that this is better than what Dr. Frame is coming up with. So I'll leave it there, everyone, and I'm gonna say this is what we did. That evening, that Friday evening, I got together with all my siblings, and I shared with them Dr. Gregerson. She had put together some live blood slides, and she actually showed the progress. And so when I shared this information, not only with Dad, but when I shared it as part of that Zoom with my siblings, his support group, it just gave them all kinds of hope. And that's really, you want to be in a place of hope when you're going into these treatments. Well, having Dad been given that diagnosis and there be no hope. So what I'd like to do is go back and just, if I could share this video about the blood slides, the same one. So it's just like, Jonathan, I'm taking your audience through this same process that we were able to empower my dad with hope. The same process that we went through as a family, and as he started this protocol that Dr. Prasad recommended.
Beautiful.
I'm going to go back and I'm going to just share this with everyone, and I'll come back in and I'll share the rest of the story with Dad. But really, really significant when we have this kind of an opportunity. Understand that results may vary. This is just experiences of others, but certainly a lot of hope and benefits from it. Here we go with Dr. Gregerson.
Okay, so I'm a naturopath. I'm in Idaho Falls, Idaho. And a lot of the things that we do is to help people balance their body, because a balanced body heals itself. So we use the microscopic, it's called microscopy, and we look at people's live blood as it's working right then. And then we dry the blood. And the way that the blood dries, different enzymes tells us a lot about what's going on in their body. We can find anything from heart sign to lymphatic problems to absorption, to all kinds of different things that we can see in the blood. It is a proven practice. They've been doing this for years. And you just can't argue with live blood that's right in front of you. And we do it so that people can see the live results right then. Well, my daughter's allergic to the capsules that are on the micro daily EMF. We tried opening the capsules, but the allergy is so bad that there was enough frequency from the capsules that she would still have problems, and she would almost go into anaphylaxis even when we emptied it. So I, for a long time, was really pushing to get this hydro product in because I knew how much she needed it. Well, I haven't checked her blood for a long time, but she happened to be here yesterday, and I took her blood, and as her mom, I just started to cry. It's really bad. So put the first 2 slides on. This is what we saw. The first slide that you will see there is extremely bad EMF. She lives in Oregon, but she works in Boise. They're just right there on the border, and a lot of EMF around her. I've got her stuff protected as much as I can, but it's just not enough with all the towers. And you can see how the blood cells are sticking together. When they do that, when blood goes through your system, so as your blood needs to go through this microcirculation, it has to go through one cell at a time. And if it's not going through one cell at a time, you're not getting the food in or the garbage out. And with it all coagulated, it's really hard to see. So on the first one, you can see the cells are so stuck to each other. There's no way that's getting in her circulation. She has severe autoimmune. She is barely eating. She's really sick. And that's one reason she came in. On the second slide, it's just another view of the same drop of blood. You can see it's all relayed. But the scary thing about that one, which was in the other one too, but they were so stuck together you couldn't see it, is how misshapen every cell is. They look like water bombs. They look like spiked balls in there. Very few of her cells looked normal. Maybe 10% of all of her blood looked like it had looked normal. They all looked like donuts, which is malnutrition, low B vitamins or low iron. They were all misshapen. And it was really scary for me as her mom to see that. Any patient, this would have scared me, but having be my own daughter was really bad. So we gave her 2 of the micro dailies because I wanted her to try it to see if she could take them now. She tasted it. It didn't bother her. She waited a minute. She drank the whole thing. And 15 minutes later, we checked her blood again because I wanted to see what it would do, never expecting what I'm seeing on this next slide. So here's the after slide. If you look at it, and I mean, I could have taken 15 different pictures of it. You can see the cells are round. They're less stuck together. There's a couple in there that are still stuck, but they're not stuck like they were before. This means that she started getting immediate hydration. She started getting immediate delivery to other parts of her body because it could get into the microcirculation and it could do what our blood's meant to do. So this was all really fun. And I did this while I was doing the call earlier today at 1 o'clock.
I'm going to pause it right there. And just maybe Dr. Prasad, you can comment a little bit about what we've seen here. This was also a part of the picture that she showed a little bit later. And it went on. Jeff went on to tell the story about his father. And I finished telling the story about his father. Something that they never expected to see was that he survived. And the results was that his body turned around, and he responded very well to the recommendation that you gave. So is that pretty much telling us, Dr. Prasad, that what you put together here, that this?
Yeah, I mean, the changes in the blood, I think it was mostly related to what she had. Is nothing to do with the cancer, as I understand. Her daughter has some allergic reactions, and then, of course, in that case, blood gets all messed up. And so what happens that once that source is gone, then blood came to a normal level. Mm-hmm. And micronutrient helped bringing the blood to a normal level. So, but had nothing to do with the cancer. It simply demonstrates the powerfulness of micro ingredient that we have in micro daily, that can reverse the effect of, as I understand, but maybe she had, I presume that she didn't have cancer, right?
She did not have cancer, but she said that what she saw in the blood cell analysis was an indication of what would eventually become cancer.
Yeah, precancerous changes. Yeah. So that again, once you have precancerous cancer, they also require glucose and glutamine metabolism. So by preventing them, they said, okay, I will not repress it. Actually, there was one case of somebody in one meeting reported that she has a precancerous changes. Doctor said, yeah, it is precancerous, and went to this therapeutic dose, and they totally disappear. No cancer.
Yeah, well, Jeff's father, the doctor said the bone marrow was not going to be producing red blood cells.
Yeah.
He went on the therapeutic dose as you recommended, and Dad came out of it.
I mean, this is, if you look, it is amazing discovery. But I think people, it will be tough. Any revolutionary idea is tough to penetrate.
Yes.
If you have no resistance, that means idea is not very good.
Absolutely. I completely agree with you on that one. Well, just for the sake of bringing this to a conclusion, there's
only one thing, Jonathan, I want to, for cancer patient or cancer survivor who have a risk of, that at least for 5 years they are cancer free, then don't take collagen peptide with that. If you have a cancer and if you are getting any kind of treatment, including microdaily, don't take collagen. And the reason is because collagen prevents the immune cell, which generally sells tumor cell killing cell called T cell, to kill tumor cells so tumor grows slowly. But if they block it, tumor grows bit faster. So we said collagen peptide, no.
Very good, very good. So here's what we want to focus on, folks. Just as you've heard Dr. Prasad recommend, and in Jeff's case and the two cases we mentioned before, obviously testimonials are purely anecdotal. But if you do want to go with what those individuals tried in their case to help the immune system do what it does and to follow what Dr. Prasad is suggesting, here's your basic formula right here. This is called the basic bundle.
Yeah.
And the retail price of this is about $164, but the subscription price is $110. So you can get it just like that. Start with this, and then add to that 2 more bottles of just the microdaily EMF. That's how you get the triple dose. So not just 3 times a day, but triple the normal amount. As Jeff said, 9 capsules, 2 or 3 times per day.
And if you can't eat content, you can't take that many capsules, then content can be mixed. Open up capsule. Content can be mixed with yogurt or anything that you like and mix it together, and then to take it. And digestive boost also, because if you are getting especially chemotherapy and radiation, digestive boost become very important because it, radiation chemotherapy, it damages your gut and every organ,
That's right.
So for them, it is very, very important to have digestive boost. So even though you are taking a 3 times therapeutic dose of EMF, I think together with the probiotics, you also take digestive boost.
Excellent. And so folks, as you're listening in, every single thing that we're showing you on the screen right now, Dr. Prasad formulated it. The CBD boost, the brain boost, sleep boost, omega-3 daily. This is the core 4. And remember, this is for everyone who's not fighting cancer. You would take the core 4 if you're not fighting cancer, because it includes the collagen peptide. So that's for everyone else. And just keep that in mind. And this is the cost. It's so reduced, it's ridiculous, because Engage Global wants everyone to have access to it. So for only $200, you get all 4 of the products out there. Okay. So but again, the collagen peptide, this is the one that you would leave out if you're fighting cancer. Don't take that one. If you do want to buy the core 4, you can always take your collagen peptide and keep it for later, stick it in storage or freeze it so that you can use it later. But whoever invited you to this discussion, they would be the ones that would be able to guide you on how to put together your order. So let's see here. Let's get, we have 2 comments that we need to try to squeeze in here, Dr. Prasad, before we wrap up. Corleen, please, your comment.
Hello, Jonathan. Hello, Dr. Prasad.
Hi.
Jonathan, I need you to help me out with this story. I just want to, because there's so many new people. Do you remember when Kareem Evans called in, Jonathan, and she was so excited you couldn't stop her from talking?
Yes, I remember that very well.
Okay, so Kareem Evans had a mom, Miss Olive, that the doctors had sent her home and said she would be dead in 3 days. There was nothing they could do, period. And Kareem got Dr. Prasad's products, and she was so determined to give these products to her mom, and she did. And it made such a significant difference. So for 19 months, she took these products, and the products helped her. She had a quality of life that only some people wouldn't even imagine. I mean, she was going around, she was doing everything. Now here's the unfortunate part. Unfortunately, on Friday, September 13th, Miss Olive transitioned. However, she transitioned because she fell, because someone was taking care of her and they weren't paying attention. And so she fell. But when I talked to Kareem, and Dr. Prasad called and talked to the pharmacists. They were allowing her to take the micro daily, the probiotic, the omega, but they wouldn't do the brain boost because the guy said it had niacin in it. Dr. Prasad explained it, but they said no, right? And I just say this because Dr. Prasad, on behalf of her family, I want to thank you for the research that you've done, for these products that you created, because you gave her 19 great additional months to live.
Wow.
And that is huge.
Wow.
And so thank you, Dr. Prasad.
Thank you.
Thank you, Jonathan, because she called in, she couldn't stop talking. She was so excited.
Yeah. And we were happy to hear it.
And you know what she said to me? She says, Corleen, all of Mom's organs were great. She fell and hit her head.
Oh, wow.
But thank you, Dr. Prasad, for those 19 months, because it gave all of us, this entire company, an opportunity to meet Olive May Johnson, who was an absolutely wonderful person. Thank you, Jonathan.
Corleen, thank you very much. And our sincerest condolences to Ms.
Yeah,
Olive.
my condolences. Yeah, tell her I deeply.
Wow.
Yeah.
But that's a beautiful thing. And it's just proof again that everything that we're learning from the professor has value. And there's a scriptural thought there that says time and unforeseen occurrences can befall us all. So accidents can happen. But in this case, Miss Olive's life, she had quality of life.
That's very quality of life, the most important thing for older people like me.
Yes, sir. Yes, sir. And we have one question we want to slip in because there's a situation that's right now active. For those of you folks who cannot stay on longer, we understand, but this will only take 3 minutes. Folks, if you would just stick with us for just 3 more minutes here so we can get this question in. Alfreda, are you there?
Yes.
Go ahead, please.
Yes, I am. Thank you for taking my call. Dr. Prasad, I want to thank you for everything that you do. And I'm going to try not to break down after Corleen's, what she said, because she shared that with me when we were in Salt Lake City.
Oh, wow.
And I want to, I have a customer right now. Her name is Tootie. And hopefully she's on the call right now. But she's in the hospital with brain cancer and also lung cancer. And so I was referred to her. And so both the lady that referred her, Shirley, and myself, we both gave her a free bottle of the micro daily, the EMF, because we needed to wait till October 3rd for her to purchase it. So I wanted her to get on it right away. But she
and probiotics as well.
Right, she didn't have that yet, but right now she's in the hospital.
Okay,
the doctors are encouraging her to stop taking the products, and I talked with her this afternoon, and I'm trying to encourage her or let her know that she actually needs the support of the products to get through the things that they're going to be doing to her.
Right.
And if possible, I'd like to arrange a call maybe tomorrow, if we can, to speak with her doctor, if that is possible. But if you could give any comments, she started taking it, and a couple days ago she was doing well. She was getting used to the regimen, and she had a lot of energy. Today she sounds very depleted of her energy. And so any words of wisdom?
She will probably brain surgery. I don't know what kind of brain tumor she has, but if she has a glioblastoma, that's done. There's nothing they can do. They tried surgery. My son, as you know, has a glioblastoma, and surgery, chemo, radiation, went through hell. Nothing. 2-3 month extension with poor quality of life. So if I have to do all over again, and if you have glioblastoma, for example, I will say, don't worry about it. Just live quietly, take as much whatever you want alternative, and surgery is okay. Surgery is a different one, but chemotherapy, radiation is worthless in terms of medulloblastoma. Either glioblastoma or medulloblastoma, it is very similar, very aggressive tumor. But if you have a schwannoma, then it's okay. Surgically, they removed, and people live very happily after that. And then take the micro daily, and this will be okay. But follow doctor advice. There, I cannot interfere with anything. But I'm just telling you my experience with the brain tumor, glioblastoma specifically, and for example, glioblastoma. President's son, Biden's son, has a 42 years old glioblastoma, same fate. Nobody lives after diagnosis more than 21 months.
Wow.
Well, they gave her,
but we don't know what kind of tumor she has.
Yeah, she hasn't mentioned that, but they did give her some radiation. I don't know if you can unmute yourself, Tootie, or tell us what.
Actually, I think, Alfreda, we may have to just continue this offline.
Okay.
We're just going a little bit long, and we need to just let folks wrap up. But at least we have some comments from Dr. Prasad on it, and the recommendation is to, at the very least, take the therapeutic doses.
Yes, and probiotics. Those two, I don't know. And if oncologists want to talk to me, I will always willing to talk to them.
We'll make sure that
important for her, but
we'll make sure that Alfreda can connect with you on that, Dr. Prasad.
Yeah. But nobody calls me. That's okay.
Yeah. So for all of you who are here right now and wondering what to do going forward, just get back with the person who invited you to this discussion, and they will guide you. They'll help you to get your order in and to be able to put together the package that you need for your specific situation.